It is excellent work, and certainly we pay homage to your teams that are working throughout the weekend to accomplish the extraordinary increase in testing and reporting of which we have been able to witness. When the government announced the new restrictions last week, we advised it was necessary to allow the doctors, technicians, analysts, contact tracers, and other resources that we employ to stem the outbreak to catch up. Last week, we also advised the current outbreak was created due to about 7 clusters of infections that spread due to people not adhering to the guidelines and protocols that were in place. As evidence of what was occurring, we found that more than half of the new cases were Bermudians under the age of 30 years old, and most new infections came from events, gathering, and persons socializing. The rise in cases, the lack of accurate tracing information from residents, and a minority of Bermudians choosing to flout the protocols meant that the government was required to significantly increase testing capacity to provide people with the information they need to make the decisions for them and their family. Last week, dozens of Bermudians had to decide whether to get tested, quarantine, or do nothing because science meant that they were unaffected. And so, before I go on, I wish to apologize to anyone who may have had undue stress or worry while waiting for their test results over the past week. Last week, some of you may recall that I stated that the Ministry of Health will increase its testing capacity. The government's goal was to ensure that everyone who needed to be tested was tested and had access to a facility for that testing. Last week, we set a goal that we wanted to be able to conduct at least 1,000 tests per day. Some statistics to share. Between Tuesday, December 1st and Saturday, December 5th, there were 3,479 testing samples received at the Bermuda Government Molecular Diagnostic Laboratory. That was the week before. So again, that was Tuesday, December 1st to Saturday, December 5th. And that 3,479 over those 5 days means that there were an average of 695 samples received each day for processing at the lab. However, between Tuesday, December 8th and Saturday, December 12th, there were 6,741 test samples that were received at the Bermuda Government Molecular Diagnostic Laboratory. This is an average of 1,348 per day. This means that in the same period the week before, between last week and the week before, the lab received 94% more testing samples, quite simply shattering the target that was set for 1,000 tests a day. Before I go further, I want to thank everyone who helped make that happen. The testers, the administrators, the doctors and nurses who came online and answered the call to help collect more samples, the testing teams, the transporters, everyone who had a part to play. This is absolutely amazing. Unfortunately, as a result of that significant increase in testing, there was delay in the lab providing the results. As of today, I am informed that the lab has caught up with this backlog. And moving forward, the lab will still endeavor to issue results within 24 hours. But as the Minister of Health said, you should not expect your results be outside of 48 hours. But if all goes well, the speed and service of which we've been used to in Bermuda will be able to continue. Testing remains an important factor in containing the spread of the virus. The sooner we know if someone has tested positive, the required actions can be put into place. Last week, I announced assistance for workers and employees who have had their businesses shut down or are impacted by quarantine orders that have been issued by the Minister of Health. The deadline was today to apply to ensure that payment was issued this week. For those persons who did not get to apply this week, that does not mean that you cannot still apply. The application can be found if you go to www.gov.bm. At the very top on that red banner, it has a link to the unemployment benefit application. You can complete that form whether your business has been affected by a closure order, which has been issued by the Minister of Health, or if you have received a quarantine notice to quarantine by the Minister of Health as well. Again, that website, you can just go to gov.bm, and the link is right at the top of the page in order to fill out and complete that application. Further, last week I announced that the government will also be making support available to businesses who have been affected either by business closures or by reduced business as a result of the pandemic. The Bermuda Economic Development Corporation will be administering that relief, and they will announce the specifics of the support later this week. But I can advise that businesses will receive support for their overheads, which still continue while they are unable to generate business. The confirmed positive case numbers announced by the Minister of Health in recent days has been alarming, which is why the restrictions imposed last week and the additional measures, including the 11 p.m. to 5 a.m. curfew put in place from 6 a.m. on Saturday, will help us with the spread of the virus. If you need to move around during the curfew hours, a curfew exemption form must be filled in. Again, you can find that form at gov.bm. At the very top, there is a red banner, and it has a link to the curfew exemption form. On that form, there are a list of people who are already exempt from completing the form. This includes, which is a key point, persons who have to pick up travelers from the airport and taxi drivers who may be transporting passengers who are exempt or have received an exemption. Now, this is a key point because I received a question from a taxi driver over the weekend. If you are transporting or picking up people from the late flight from Miami, you are allowed to pick up those persons and transport them. You are allowed to transport people who are in the possession of an exemption, for instance, nurses who may be going to the hospital or otherwise. However, outside of that, if you are transporting persons outside or inside of curfew hours, you are in violation of the law. And I would encourage persons to please ensure that they are not in violation of the law. The goal of imposing the curfew is to stop and reduce persons from moving around, to reduce the number of people that may be socializing in various different households and the time of which they're socializing in an attempt to minimize contact to reduce the spread of the virus. Additionally, of course, if you can work from home, please do so. Employers, if your staff can work from home, allow them to do so. Employees who must physically go into work, please ensure that all precautions are followed. The broken record will continue on this side, but we're going to switch it up a little bit because everyone must wash your hands and maintain good hand hygiene. Everyone must wear a mask, and everyone must continue to maintain physical distance. But there is one more thing that must be added to that, and that is everyone should download the We Health Bermuda app on their phone. The app can be downloaded from the App Store for Apple or Google Play for Android phones, and you can find it by searching We Health Bermuda. I'd like to thank the cell phone companies, Digicel and One Communications, who worked collaboratively with the government to issue a text message today to all cell phone users in Bermuda. The message provided a link so you can access the app quickly and easily. And if you have not downloaded the app, I encourage you to do so right now. I've explained before, but I want to explain it again in case persons didn't hear it. The app works by ensuring that after a person is tested, if they are positive for the coronavirus and have downloaded the app, they are given a randomized verification code by the team at the Ministry of Health. That person will enter the code into the app, and the We Health Bermuda app will then anonymously notify other We Health Bermuda app users that an infected person was in close proximity, even if they don't know the person. Now, as I've said, This takes into account sophisticated modeling, the distance of which you are apart, the amount of time of which you may or may not have been together in close proximity. It is a very sophisticated program that analyzes the risk of exposure. We Health Bermuda does not use or collect personal information or track users' locations. Therefore, these notifications will be completely anonymous. The We Health Bermuda app uses secure Bluetooth signals to measure how long and how close users were together. Once you download and install the app will run in the background and alert you to any exposure risks, and uses very little data or battery life to run on your phone. If you do not have data on your phone and only have a phone that is able to use Wi-Fi when you're in Wi-Fi range, the app will still work as long as you have Bluetooth on and will get any updates from exposures when you are in range. Please encourage your friends, family, and coworkers to download We Health Bermuda. As of yesterday, just over 11,000 people have downloaded the app. In addition to downloading the app, the other important piece is those who are confirmed positive and have the app must be willing to put in the randomized code. A reminder to if that may apply to you in the future. No one will know who the code came from. This is the key to the success of the app and for people using it. It is 100% anonymous. Again, it is 100% anonymous, and no one can see who is sending the information, and no information is collected or shared about the user. The We Health Bermuda app is valuable certainly to restaurants, salons, grocery stores, and other retail locations where they may be relative close contact. I urge business owners to ensure that all of their employees have the app installed on their phone, and also to encourage customers to download the app to their phones as well. If a customer and employee is using the app, it can alert that employee that an infected customer, that they would have come into contact with a customer who may have been infected, and they will be able to know this the employee would be able to know this. The reason why this is important is that information can allow an employee and their employer to take actions to protect their employees and customers and to ensure that their livelihood is protected. This is a key distinction. Right now, all staff in an establishment may be directed to quarantine, whereas if the app was installed and in use, selective quarantine may be able to be used instead. That is a key point, and that's why it is so key and critical that all persons use this app. It makes the contact tracer's job easier, and it will relieve the stress versus wide quarantines to more targeted quarantines. The Department of Communications has been hosting virtual presentations about the app and sharing flyers and other graphics with attendees. Those of you who have attended meetings, I encourage you to share the information with your members and member organizations. Print the graphics and place them in prominent places so the QR code can be scanned and the app downloaded. And the flyers can be found on gov.bm/wehealth. In closing, as was said, we are seeing an increasing number of people under 30 who are contracting the virus. I cannot emphasize enough, while there are many who may not have symptoms, these persons can still transmit the virus to others. And we can see it going from people under the age of 30 to going to their parents to going to their parents' parents, and possibly impacting persons who may be more vulnerable to the virus. I urge families to please be vigilant. The challenges that can arise from where we are to where we can be in 2 to 3 or 4 weeks, if there is transmission within families to persons who are older, we can see that hospitalization rate, which has not risen, to slowly begin to increase and lead us to a worse place. I urge families to be vigilant. I urge families, especially parents, guardians, aunts, uncles, and other persons, to make sure that we are speaking to young people and make sure you are shielding vulnerable persons. This is very, very important. Right now, over the next few weeks, we have the time that we can combat this outbreak, but it is required for all of us to be vigilant and to make sure we are minimizing our contact. We are our brothers and sisters keepers, and we have to make sure that we continue to work together so we can stop this current outbreak. With that, I'm happy to answer any questions that members of the media may have.
Good evening. We're going to start the questions off from a question from TNN.
We have record amounts of tests done over the last 4 to 5 days. There are still individuals that are becoming extremely frustrated, waiting, especially the Delwood 300, that are waiting. It's been, one individual said, 17 days for the result to come out of quarantine. What is the numbers for outstanding results from Thursday, Friday, Saturday, and Sunday?
Trevor, I don't have the exact numbers of the ones that are outstanding, but I think what's particularly critical to note concerning your question is the amount of testing that has taken place over the last several days. The reality of the situation is that not only are we testing more aggressively, but we're testing those persons that are either symptomatic or are close contacts of positive cases. And the best way to try to minimize the spread and the transmission is to test those persons that are close contacts. I can appreciate that persons are anxious and that persons are wishing to have their results, but again, we have had such a surge with respect to recent testing. We're just imploring persons to just be patient. Obviously, whilst they're waiting for their test results, they should continue with the public health guidance as it relates to remaining in quarantine, but we will get the results to persons as quickly as possible. We've been working around the clock, and all persons are convicted of trying to get the test results out as quickly as possible. So I'm just imploring members of the public to please bear with us and to be patient. This is for the benefit of all persons.
And with that, I think it's important that they, two things. Number one, no one has to wait 17 days for a test result. And so if they haven't received their test results, as was indicated the last time we were here, there's probably an issue with their email address or something else. They should call in and to look to try to get that resolved. But I think what's important, as the Minister of Health said, and it's critical to note, that this team has been working around the clock. A 94% increase in samples week over week is incredible and is coming from a very, very high place. Just to give some statistics, and I think this is important to note, this is what was emailed out from the Bermuda Molecular Diagnostic Laboratory, the government lab, and these are negative results. On Friday, 888 emails were sent. On Saturday, 889 emails were sent. On Sunday, 1,877 emails were sent, and on Monday, today, 3,339 emails were sent. So yes, there was a backlog, but that backlog, through a lot of work, a lot of help between the Ministry of Health teams and coordination to get additional resources in place to make sure these things can be handled, was taking place. So while persons may want to find criticism and fault with the effort, I am immensely proud of the work that all of our teams have done under, as the Minister of Health has said, incredibly difficult circumstances to get us to where we are today. We have tested a significant amount of people, and it's a good thing. Final answer to your question, Trevor. There are 105 results outstanding from Sunday from the Bermuda Government Molecular Diagnostic Laboratory, and that, of course, includes flights that arrived late last evening. Only 105 left to go.
Next question.
Premier, since we're on this topic, you stated tonight about the average age of our latest positive results as young people. What is the consequences, if proven, a person is ignoring the COVID-19 regulations after being tested and the results being positive? Are they being monitored, and what are the consequences for these individuals? Because one, remember the group of the couple that was put in court for attending a wedding when this first being in quarantine. Are these young people being monitored, and what's the process?
The Persons that are placed in quarantine, Trevor, or positive cases, I think you're speaking about the positive cases who are then subject to isolation. Fortunately, we have very, very high levels of compliance as it relates to Bermudian residents and other persons that reside in Bermuda, the residents that test positive. There is a very high level of compliance. However, clearly, in circumstances where a person has been instructed by public health to remain in quarantine as a result of a positive diagnosis, then therefore those persons, if they are found to be in breach of that, there are very, very strict penalties under the legislation that are financial penalties as well as potential terms of imprisonment, depending, of course, on the will, so to speak, of the magistrate. But there are very severe penalties concerning the breach of any of the public health regulations as it relates to the requirement to quarantine and or to isolate. But again, overall, there is very high levels of compliance.
Next question.
Minister, matter of fact, Premier, Marine Department workers are extremely concerned this evening with the high volume of passengers they are transporting due to the fact that there are no buses on the road. One, when are the buses due to return? And two, are there going to be reduction in services for ferry workers?
I don't have that information in front of me. I know that we had a meeting earlier today with the Minister of Transport, who, having received additional information from the Ministry of Health, will be speaking with DPT management and union partners on the restart of the bus service. And so from that perspective, that's the best answer which I can give. What I would say regarding ferry staff and others, as long as the guidelines are being followed, we are confident that the staff remain safe as long as the guidance that has been issued is followed.
Next question.
I have some concerns from some seniors that gave me a call reference to GHI doesn't cover much at all for their needs. There are a lot of seniors that are in need of help. Where do they go? Number one, age concern has been a great help, but can the government do more to assist these seniors?
I'm uncertain as to the question that's being asked. GHI is the Government Employee Health Insurance Program that covers persons and retirees. It's a comprehensive health program, and so I'm not entirely certain. But what I would say, if there is anyone who is in need of additional assistance financially, especially given that senior citizens are the number one beneficiary of financial assistance, I would certainly encourage them to contact there, as there are certainly help that is available, and there are funds that are available to assist.
Next question.
Premier, there was some disturbing activity over the weekend, disturbing video circulating yesterday. We haven't heard from your office or the Minister of National Security on this incident. Why has the government been somewhat quiet?
I'm not certain in regards to the government being quiet. I don't know if the Minister of National Security has issued a statement, or I think that the statement did go out. If I know what you reference, but I think I remember seeing something. But I would say that I am certainly intently focused on working with the Minister of Health to make sure we can direct all possible resources to our current battle with this outbreak. So I apologize if I haven't been up on the comings and goings in that matter.
My last question, sir. CNN understands that the staff at DCFS has been tested positive for the coronavirus, and will the department be quarantined, and what happens to the service for these parents that are a part of that program?
The first thing which I will say is that we would certainly never comment on any person, department, or otherwise. I don't want to speak to that because I don't necessarily know. But what I will say is that there are plans that are put into effect to ensure that services continue. And so if that was the case, unless there has been some type of interruption in service, I would assume that the services are being provided, and the team is enacting the pandemic response plan, which all government departments have.
Thank you, Trevor.
Thank you much.
Good evening.
Good evening, Ms. Palacio.
Maya Falacio for Media Maya. I'll try to pull this up. A member of the community is a little concerned about something she's been seeing reoccurring. She says employers are demanding employees to get tested and turn in their results, even when the employee has contacted the health department and the health department has stated that they do not need one or they do not need to inform their employer. Some employers are sending employees home without pay due to this. What can an employee do in this situation?
Just so I can understand the question, they are sending home their employees without pay due to what specifically?
Not showing either the results from their tests of COVID.
Not sharing the results from their
Yeah.
tests? That I think I will let the lawyer here.
Well, it's perhaps concerning the issues about what potentially they can be making applications for the employment aspect, for
Well,
the funding. But there is no legal requirement for persons to reveal the results of their particular test. I think what I spoke about last week, Maya, that's critically important for the employers to recognize that when a case is identified, then the contact tracing team as well as environmental health will do an assessment, a risk assessment on that particular place of employment. And more often than not, following the risk assessment and the contact tracing, they're able to isolate and identify and isolate perhaps a few people in that particular place of employment. But for whatever reason, employers are, and perhaps because they don't fully understand the process, are closing down their businesses when there may have been only one or two persons that might have been in contact with that case, when it's unnecessary to close down their business. But again, obviously the government can't control who operates or who doesn't. But the reality is we would really invite employers to allow the contact tracing team to do their job. And if they decide, following a risk assessment, that it's necessary for the place of employment to be closed, perhaps for deep cleaning or the like, then allow that decision to be made by the health department as opposed to the employers doing it, because it is creating unnecessary hardship on a number of people that work at that place of employment when they may not have been a contact or affected at all by that particular case.
Thank you.
I would comment further to say that on the issue of which you had raised, employers cannot send people home without working for pay because they haven't shown their negative test results for them. I mean, the test results are not the business of the employer. As the Minister of Health has said, if someone tests positive, this is a communicable disease, as is stated inside of the Public Health Acts, and the department will inform the employer when the employee states the case. But it's not up for, if you follow what I'm saying, it's not up for people to have to share their information, and it would not be proper if someone has not shown a negative test result to say that someone would not be able to work. So I'm not entirely certain of that. If there are specific question instances of someone who may have written into you, they're welcome to share that information by email to premier@gov.bm. But I would say on a broad level that would not be well, and employers should not be asking persons for their private medical information at all.
Thank you. And I guess a follow-up for that would be, what can an employee, sorry. The follow-up question for that would be, what can an employee do in that situation?
Well, an employee can certainly go to the Department of Labor, which is there to regulate labor activity inside the country. I mean, it would, for an employer to say that you have to have this and then you cannot come to work, I don't think is in keeping with it. It would seem rather unreasonable for persons who may or may not be exposed. There is things that are there, persons who, and in this case and instance, if there are people who have been identified as close contacts or and who have been asked to quarantine and then go ahead and get tested, those persons are eligible to apply for assistance from the government. And the staff and the employee would tell their employer that they have been required or asked to quarantine, but it's not for the employer to start playing doctor. That's not their role.
Thank you. The next question for you, Honorable Premier. You said before that we know more about the virus now than we did in the beginning. So my question is, why is it that we are having a higher increase in cases now than when we knew so little about it? What would you say is the deciding factor?
Can I please answer that question?
Yes.
I know it was directed to the Premier, but forgive me. With respect, it's people your age and older. It's that generation. And it is disturbing because, as you said, Maya, we do know more about the virus than we did before, and we know the level of transmission. And we know previously we thought that transmission occurred ABC ways, and now we realize that it's actually aerosol. So we know that the transmission can spread further as opposed to what was initially identified. We also now know, remember there was a time where we used to say you have to have symptoms to be able to transmit it. Now we know that's not the case. The issues that we're seeing now, particularly with respect to our latest group of cases, is all persons socializing outside their bubble in large group gatherings. And I didn't mean to pick on your generation, but unfortunately, as we're seeing in other jurisdictions, it is a younger generation that are regrettably the ones that are contracting and transmitting the disease. And it's extremely unfortunate, as I spoke about on Friday, that there seems to be no appreciation population with respect to chronic diseases, and that they can unwillingly transmit the disease to somebody that's sick that might not be able to brush it off as quickly as a 25, 30-year-old. Sorry,
you.
Premier.
Oh, that's perfectly fine.
Did you wish to add to that, Premier?
It's the question. There are two different times and two different circumstances. Remember, in November, on March 17th, the Minister of Health shut down all gyms, all bars, all churches, all restaurants, all retail establishments, everything across the entire country. And so we now have the tools to not have to do that, and we can take a more targeted approach. And certainly the targeted approach is going to lead to increased numbers in certain ways and instances, but we have the tools to manage this. We have the capacity to test more per capita in this country than any country on the planet. I think the only country that may be able to rival the amount of testing which we're able to roll out is places in China. It is that significant, the amount of testing of which we've been able to do. And if we take into account the fact that I think if you look at it over the past 10 days, we've probably done 10,000 tests. I mean, it's incredible. So we know more, certainly, of how it's transmitted. We understand more. The question which you're asking, why are the cases higher? The cases are higher because there were one or two super spreader events. I mean, the Minister of Health has linked a number of cases, or the Ministry of Health linked a number of cases to one particular event. And so this is what happens with the super spreader event sometimes, and it's unfortunate. And those things are easily avoided if people follow precautions. Precautions were not followed. These spreading events did happen, and this has caused this, the challenge which we are seeing right now. But I have every faith that with the resources that are deployed, and if everyone installs the app and we are able to have targeted quarantine and targeted things, I think we can do better, and we don't have to have that blunt instrument of total complete shutdown. We can restrict the places and challenges where they may be, large events, bars and clubs where people are socializing without masks, where that spread can happen, and I think we can be in a better place.
Thank you. And since we're on the topic of age range, and I meant to send this question in ahead of time, but in the positive cases by age and gender, the graphic does show that 20 to 29-year-old females have tested the highest for COVID-19. Can the Ministry of Health also provide a graphic of the age and gender of those who actually go and get tested for COVID-19?
I will see if that's something that can be provided.
Thank you. And next question, committee member has asked, is there an email address that people can obviously email to report gatherings after they've happened instead of calling the 211 number?
All of the infractions should be reported to 211. So even if it's after the fact, and it's unfortunate if they're observing it and they call after the fact, but in any event, we're encouraging persons to utilize that particular mechanism for reporting infractions, which is a call to 211.
Thank you. And then an update on the winter camp regulations, if that's been classified yet.
There'll be further announcements probably at the Wednesday's press conference, if not before, concerning decisions surrounding that.
And my final question, I think it's my final question. Thank you. Community wants to know, in terms of the vaccine, will government be imposing any restrictions on those who do not want to take the vaccine?
Friday, I actually did a ministerial statement with respect to the status of the vaccine, and our hope is that we will receive the Pfizer by the first week of January. However, as I indicated in that statement as well, Maya, what we're seeing is that there are a number, IATA, for example, has indicated that if you wish to travel, you're going to need to have a vaccine passport, which confirms that you've got the COVID-19 vaccination. So the fact that Bermuda is not necessarily considering whether or not there'll be any restrictions on persons who do or do not have the vaccine, that matter might be decided by other persons, because I'm sure most Bermudians don't want to end up staying on this rock. Any international travel, which means leaving Bermuda, will require the vaccine passport, and that's why IATA has already indicated that.
All right, thank you very much. There's no questions.
Where was that?
Did I say rock? Did I say rock? Oh, gosh.
Thank you, folks. Jonathan Bell from the Raw Gazette. Mr. Premier, actually, a question has literally just come through to me, and it's regarding We Health. If it'll help with We Health, let's give it a shot. This is someone who I guess was listening to you, and they want to know if someone has COVID, they shouldn't be out anyway. Why are they out and about if this is real-time exposure with someone that should be in quarantine? Yes, if you could clear that one up for me.
That's fine. The fact is that they may test positive. Remember, this is contact tracing. So if someone tests positive on a Wednesday, for instance, so someone could have gone to get a test at the testing center today. They may get their results tomorrow or maybe even Wednesday, but they may get their results tomorrow. When those results are reported, they are positive, and of course they'll be contacted by Health. Health will then give them a code after having an interview with them and ask them, possible exposure time, etc. And then that notification that is sent is based upon the information which they provide. So in this instance, someone who has tested positive on Monday, or who got a sample on Monday and took a test, may not have known they were positive. So they may have been just out in the community, they may have gone to church, they may have gone to a restaurant, they may have gone somewhere else for the preceding 4 or 5 days. And versus them having to remember this, versus the health department that have to contact all the various restaurants and establishments trying to find out who was there at this time, etc., all the rest, other things in that level, it can send a notification to people who may have been close enough to this person to have possibly been exposed. So it's not as though positive people are out, but if in this instance where persons who are found to be positive, then at least they can assist with the contact tracers by sending anonymous exposure notifications to anyone with whom they may have been in proximity for the amount of time to actually trigger that notification.
I think that clears that one up.
Happy to help.
Okay, moving on. Obviously, there is a lot going on right now, but a few people have asked what happened to the breakdown of cases by race. Presumably, it's the volume. Well, if there's any comeback on that, Minister of
It
Health?
is certainly nothing sinister about that, but the reality is that there's a lot of data that's being collected for a lot of important reasons from an epidemiological perspective, so that we can try to track and trace the projection, so to speak, of this. So it's not by any sinister means. If once we're able to basically catch our breath, then we will be able to perhaps provide that fulsome reports. But right now, unfortunately, we are,
Too
as
busy.
you could, yes.
Minister of Health, you may be able to answer this one. We had that BA flight at the end of October that I believe there were 10 cases associated with that flight. It was being investigated. Do we know anything more about that flight? Was it a different strain? Special
Actually, Jonathan, let me
circumstances
check
the
on
flight?
that, because we did send off some of those results to Public Health England so that we could see whether or not there was, so that we could get a further analysis of that. So I need to check on that, and let me get back to you. So that was that BA flight with respect to the 10 positives. Let me find out, because we did send some samples over to Public Health England to for further assessment. So let me get that information and I'll get back to you. Okay, I'll make a note of that.
And following on that, I did see that there was this some form of new strain in the UK. Not much about it is known. It may be a quicker spreader. They don't know that for sure, but it seems to be more prevalent in places where there have been more cases. Is this going to affect any way that we police ourselves against the virus at home with presumably later this month there will be more people coming home for the holidays from the UK.
I can't answer that either. As of Friday, the information I received from my team was that there was only one strain, and that the vaccine that we'll be getting will be to address that one particular strain. You're telling me information that I'm not familiar with, so.
Oh, I don't think it affects the vaccine. It just seems to be a new strain,
No, but
strain that spreads.
They indicated that as of Friday, there was only the one strain. So if this is new information, I'll have to get it from the team and get back to you about that as well.
And actually following on from that, so we know about Pfizer in early January. Is there any update, I guess, on how the Moderna are coming along in terms of availability?
Not
here?
since Friday, no.
Oh, yeah. I believe this is my last one. Minister, you mentioned that, I think I caught it right, that there are people who are just repeatedly getting tested and tested, that there's a chance some of these folks can get bumped off the list of testing, if I heard you right. Could you explain a bit how that process works?
Certainly. What we're finding is that, unfortunately, we have a number of people that we would refer to as the worried well.
Yeah.
And they make multiple tests. So multiple appointments for tests. So they may have scheduled 3 tests this week and 3 tests next week. Yes. And our mechanism for testing isn't even that often. So the reality is we're going through that, and we've seen a number of individuals that have a multiple amount of tests that have been scheduled over the next several weeks. So there's no need for them to have 4 and 6 and 8 tests. So we're going through that so that we can create more capacity for those persons that also want to get a test.
Right on. Thank you, Minister.
Jonathan. John Burgess?
Good evening. Health Minister, with the surge, what is the current projection of how many more cases Bermuda will get based on the COVID Sim EU modeling we are using?
I don't have that answer specifically. However, based on discussions that we had this morning with the case management team, we are anticipating that some of the cases that we're seeing now with respect to being positive are from events that took place about 2 weeks ago. So we do anticipate that we will continue to see increases in our cases associated with a particular event that you've heard me speak about.
Do you have any sort of an approximate number?
No.
How many? Okay, thank you. I know, like with the testing, you've asked extra people come in to help. Are you also drafting in other departments and volunteers to help with the contact tracing, or is that a specialized skill?
It is a specialized skill. However, we do have a number of persons that are also being trained this week to do the contact tracing. And as I mentioned previously, some of the persons that were doing it during the height, like in March and April, from other departments, we're trying to secure them to return to us. But many of them do have other positions that they have had to go back to. But we're working with the head of the public service so that those persons can come back to health. But we do have a number of persons that are being trained and starting up this week. And again, the benefit of technology through the We Health app will be a tremendous benefit to the contact tracing.
I noticed from the numbers tonight that the contact tracers identified 25 out of the 71 that were unidentified from yesterday. And do you happen to know generally what categories that those people who are identified fell into?
Well, of the 25,
Yes.
4 of them are travelers, and then the other 20, as I've indicated, are classified as under investigation.
Oh, I'm sorry. The contact tracers, from yesterday's report, there were 71 people who were unidentified. And from today's report, with the numbers that you reported, 25 of those that were unidentified yesterday have since been identified. So just generally, do we know where they fit into, what other categories they
I'm
move
not
from?
sure I understand your question, but the 25 I'm reporting today have not been previously reported, the
No,
25.
I'm sorry. In yesterday's report, with
were
the 40
40.
cases,
Don, I get what you're saying. Yesterday, there were 71 under investigation.
Right.
Now, with the amount that are under investigation now, it's just a reduction versus that means that there were 25 cases that were previously listed under investigation, which have now been linked. And the question
Yes.
which you're asked the Minister of Health is, does she have any indication or can she share as to what categories those may be, whether they be workplace, social, and otherwise?
No, I cannot.
All right, thank you very much, Mr. Premier, with the assist.
No problem. But
There are
for-
60 under investigation now.
Right, because with the, doing all the math.
Yes, but I will say this, as the minister reported to us in a meeting earlier, and as she's indicated today, a large number of the cases which we're seeing are coming from 2 particular events, and that continues to be a very large and growing cluster.
Right. You say large and growing cluster. Can you say how many are in the 2 largest clusters?
I don't have that figure in front of me, but of the positive cases that we have reported over the last several, I guess about a week, the majority of them are from one particular event, which has a subcategory, so to speak, of another event. So there's a connection, but the majority, there are over 50 connected to one particular cluster
Okay, thank you very much.
50.
and growing.
From what you have shared, Health Minister, we understand Bermuda is going to get enough vaccine for about 17,000 people to take 2 doses between Public Health England's 20% and the 4,500 with the Pfizer. What is being done to secure more vaccine?
Well, through the COVAX facility, it's the 20%, and then Public Health England in the first trunk is the 9,000, which, as you rightly said, would represent enough sufficient for 4,500. But remember, the United Kingdom has already said that the proportion that all the OTCs will get will be the same proportion that they are getting to the United Kingdom. And I can assure you they're not getting just 10% in the United Kingdom. So whatever proportion they receive, we will receive. And we have all confidence that between the Public Health England as well as the COVAX facility that we will have sufficient for any Bermudian and every resident of Bermuda to have the vaccine that requires it.
Okay. My last question. I was made to understand that Dame Marjorie Hope Bean Academy was open today, whereas the rest of the public schools were closed. Is there a particular reason for that?
That question would probably be better suited to the Minister of Education. I can't answer that, I'm afraid. Sorry.
Okay, thank you very much.
That's all. Okay, thank you very much to members of the media for the questions and members of the public for their attention. I will end with a public service announcement. Many in our community are experiencing high levels of stress due to the impact of the pandemic. If you need help and someone to talk with, help is available. Please call and take advantage of the Emotional Wellbeing Hotline, which is 543-1111. Again, the Emotional Wellbeing Hotline, 543-1111, and someone will be on that line to help you. In closing, from today's press conferences, as you see, we're here on Monday instead of on our traditional Tuesday. We will not be here on Tuesday, and we expect to be back with you again on Wednesday, but that may be pushed to Thursday, but we will be in front of you again this week. We're just confirming the schedule. The expectation at this time is Monday, Wednesday, and Friday at 5:45, and starting next Wednesday, we'll be back at the Barclay Institute Cafetorium. So thank you for the team at CITV and also Department of Communications for their work to set that space back up to ensure that we can be properly and adequately socially distanced. So thank you all, Bermuda, for your attention, and good night, Bermuda.